Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Imagine for a moment the intricate symphony of the human endocrine system, a delicate balance of hormones orchestrating growth, metabolism, reproduction. Within this complex interplay, even minor disruptions can lead to significant health changes. Polycystic ovarian syndrome, or PCOS, exemplifies such a disruption, affecting millions of women worldwide. This condition not only influences hormonal balance, but also casts a profound shadow over fertility, altering the dreams and aspirations of many. So, by fostering open conversations and enhancing awareness, we empower women to navigate their health journeys with confidence and make informed decisions. This discussion aims to delve into the complexities of PCOS and fertility, shedding light on their significance and exploring solutions that prioritize women's well being and overall health. Welcome, everyone. I'm Dr. Soumya Saluja from THIP MEDIA, and today we turn our attention to how PCOS affects fertility. To delve deeper into this topic, we are honored to have with us a distinguished medical expert, Dr. Manvi Rai. Dr. Manvi Rai is a highly esteemed fertility specialist with over a decade of experience in improving reproductive outcomes for individuals, couples facing infertility. She earned her post-graduation in obstetrics and gynecology from Mumbai, followed by a prestigious fellowship in reproductive medicine at the National University of Singapore. To further refine her expertise, she pursued a diploma in reproductive medicine and sexual health from the University of South Wales, UK. Driven by a deep commitment to addressing infertility challenges, Dr. Rai combines her extensive knowledge with a compassionate approach, making her a trusted IVF specialist in Noida. She is the director at the Divine Women and IVF Clinic and a senior consultant at the Motherhood Hospital, Noida. Ma'am offers a wide range of advanced fertility treatments, including in vitro fertilization or IVF, intrauterine insemination or IUI, and advanced procedures like PGTA, endometrial receptivity analysis, lymphocyte immunotherapy, and therapies using endometrial, ovarian platelet rich plasma, and stem cell therapy. Beyond clinical practice, Dr. Rai is dedicated to patient education and empowerment, ensuring individuals have the knowledge they need to make informed decisions about their reproductive health. Ma'am's unwavering commitment to integrating cutting edge reproductive technologies with personalized, empathetic care has helped countless individuals achieve their dream of parenthood. Dr. Manvi Rai, THIP Media welcomes you, ma'am.
Hi, thank you.
Thank you so much for joining us today, ma'am. Ma'am, as you're well aware, women with PCOS, they often face challenges related not just to their hormonal balance, but also their fertility, right? So to start off this conversation, I'd like to ask that what exactly is PCOS and how does it affect or affects fertility?
Yeah, hi. So, PCOS is a very common health problem which we are facing, especially in young adults. And
Okay.
PCOD is not it's not a problem or something which you need to tackle on a very, big stage. But PCOS is just a hormonal imbalance in the body, which
Okay.
happens in females of young age, and it can happen in any age. It's not necessary it is in young age only. It
Okay.
does affect your fertility because it is going to affect your ovulation. So once
Okay.
if the ovulation gets affected, the fertility will definitely get affected. And there are various ways in which PCOS can affect fertility, which I'll tell in the ongoing process.
Okay, right. And you just mentioned that because it is a hormonal imbalance and it particularly affects the ovulation process. So, just to know more about this particular phenomena, how does PCOS affect ovulation and menstrual cycles?
So, PCOS affecting ovulation, first you need to understand what exactly is ovulation. So, in
Right,
ovulation, basically when the female is menstruating on the day 13, 14, she is ovulating. That is how
right,
normal cycle goes. And during ovulation, when they are trying for pregnancy, they might conceive. But in
right,
case of PCOD patients, that ovulation does not happen at the correct time. That
okay,
can be irregular, periods can be irregular. So, definitely, then it can lead to fertility problems.
okay,
Apart from that, since our periods are irregular, there is also thinning of the lining of the uterus, which can also affect implantation.
okay,
Other than that, there are other problems also. There is insulin resistance in the body. There are many
right,
free hormones, male hormones, androgen in the body, which can affect
right,
the quality of eggs also. So these
okay.
are the various ways which PCOS can affect your fertility.
Right, ma'am. And like you just mentioned, that PCOS is a condition, it's a syndrome that is being complicated by male hormones, which we usually call the high content of androgen hormone, and of course, it is
Mm,
associated with insulin
mm,
resistance.
mm.
So, how is this PCOS related insulin resistance associated with fertility in women who are struggling with the condition?
See, insulin resistance has a very high connection with with PCOS.
Right.
Almost 65 to 80% of the patients who have PCOS will suffer from insulin resistance.
My God.
Basically, the androgen levels are very high. So because of that, the insulin resistance is there. Basically, what is insulin resistance? Your cells become resistant to insulin. So that is the major factor. And
Right.
somehow this can be controlled. We can give medicines like metformin. Lifestyle changes can definitely affect this. And other
Right.
than that, there are also adipose tissues which gets deposited in your body, which can lead to insulin resistance.
ओके, राइट, राइट। एंड अभी क्योंकि हम उन महिलाओं के बारे में बात ही कर रहे हैं जो पीसीओएस से स्ट्रगल कर रही हैं मैम, तो
Right.
अपार्ट फ्रॉम दीज मैकेनिज्म, सबके लिए ये मैकेनिज्म समझना बहुत मुश्किल है, लेकिन इस
Hmm.
कंडीशन के लक्षण समझना थोड़ा इजी पड़ेगा उनके लिए,
Right.
राइट
Right.
मैम? सो व्हाट आर द कॉमन सिम्टम्स ऑफ दिस पीसीओएस रिलेटेड
Hmm.
इनफर्टिलिटी इन वुमेन?
Hmm. See, basically, when what common symptoms we find is irregular menses, there is
ठीक है,
excessive weight gain, there is
ठीक है,
excessive hair growth, and
राइट,
also when people are trying to conceive, they are not able to conceive. So these are
ओके,
some of the common symptoms which we see, and there's also sometimes acne associated with it. So
ओके,
these are some of the common symptoms which we can see in PCOS.
राइट, राइट मैम। और जिनको ये सिम्टम्स अपने में ऑब्जर्व कर रहे हैं, जो
Mm-hmm.
फीमेल्स अपने में ऑब्जर्व कर रही हैं, तो अगर वो आपके पास आते हैं फॉर दैट पर्टिकुलर
Mm-hmm.
ट्रीटमेंट, व्हाट आर द
Mm-hmm.
ट्रीटमेंट ऑप्शंस अवेलेबल फॉर पीसीओएस रिलेटेड इनफर्टिलिटी?
See, the treatment options will go first with lifestyle management. In
राइट,
lifestyle management, you will have to see that you have a, BMI of a normal range. Your weight
राइट,
is not excessively much because this
ओके,
will again enhance the PCOS symptoms. Other
राइट,
than that, the food and the diet should also be a good one. Matlab, it should not be only processed foods. You should have green leafy vegetables, fruits maximum. Avoid having processed foods, avoid having too much of glycemic index foods where the
ओके,
glycemic index is increased. Other
राइट,
than that, those patients who are trying to conceive can go step by step, meet their fertility specialist, and decide accordingly. They can be
ओके,
given medications, they can be given options of laparoscopic ovarian drilling. Other than
ओके,
that, there are several procedures also like IUI and IVF which can be done for them.
okay, right. And now coming to something that you must be experiencing in your regular practice. Now, you've been practicing for almost a decade now, right? So you must have come across बहुत सारी भ्रांतियां, misconceptions, because you're practicing in India, right?
Right,
So,
right, right,
what?
right.
Yes, ma'am. So, what are some common misconceptions or myths about this
Mm,
PCOS related fertility?
mm, mm, mm. So, the most common which we have heard is like PCOS females are infertile. It's
Hanji.
not like that. They're not infertile.
Okay.
Obviously, yes, Sometimes some of them can face problem in conceiving, but they're not infertile. With the help of infertility specialist or your gynecologist, you can definitely conceive. This is a big misconception.
Okay.
Apart from this, they also many of them say PCOS is so uncommon, it's a rare condition.
Mhm.
Actually speaking, nowadays the youth, around 5 to 10% of the youth are suffering from PCOS because maybe of lifestyle, sedentary lifestyle they have, having all kind of processed foods.
Okay.
And there's also one misconception that PCOS can only lead to infertility. So that's not
Okay.
right. PCOS can affect in various ways. Since there's insulin resistance, as we had mentioned earlier, it can also lead to diabetes, type 2
Right.
diabetic mellitus. It can cause cancers. It can cause various other metabolic syndromes in the body. So,
Okay.
keeping it to the point that, PCOS is only related to infertility, it's not like that. And
Okay.
they also have a misconception that, PCOS patients are only those who are obese. It's not like that. Even thin people can have PCOS. And there is not always acne and weight gain problem or
Mm-hmm.
hirsutism, that excessive hair
Mm-hmm.
growth.
Right.
Sometimes you don't have any symptoms.
Right. So an asymptomatic condition can be even worse because it can just
Yeah, it
be,
can be worse. Yeah, but in
yes.
that case, they can land up in infertility. Yes.
Yes.
So then when we
Yes.
go for tests and we do ultrasounds, then we diagnose it.
Right, right. So because the condition shouldn't be going unnoticed, right?
Mhm.
Coming on to something that we have been working very hard on is empowering the women
Mhm.
patients in particular. So
Mhm.
how would you say that improved health literacy
Mhm.
empower patients who are struggling with PCOS to make informed decisions about their fertility treatments?
See, when the female knows what exactly PCOS is, and
Right,
once they know the symptoms, then they can definitely say that, I have PCOD or I have these symptoms. Unless and
right.
until they don't know anything about it, they will never be able to diagnose for themselves. Only
Yes,
when you realize things, you will go to someone for help. When you do not realize things, you will not go for help. You will think that these things are normal. शायद मुझे
oh,
acne हो रही है, but that is normal.
yes.
हेयर ग्रोथ हो रहा है बट वो नॉर्मल है unless and until you know what PCOD is, what symptoms it
Right.
is, what are the treatments available, you will never go for help.
Right, right. So knowing is the key here, right? And I'm
Exactly.
just going to add that I think they can always come up to health professionals like yourself to know
Hmm.
what's right. थोड़ा
Hmm.
सा भी अगर लग रहा है तो डॉक्टर से आके बात करने में कोई हर्ज नहीं है।
Exactly. Huh.
जी, जी।
That
So I'm
barrier
just,
needs to be broken.
हाँ जी, बिल्कुल क्योंकि वो चुप्पी तोड़ना ही इम्पोर्टेंट है
Huh.
just to make the
Exactly.
first step, I suppose. Right, ma'am?
Exactly.
Right. So I'm just going to, just summarize this entire beautiful session on PCOS and fertility. What are the key steps or actions that, doctors like yourself would recommend for patients with PCOS who are planning to conceive?
See, first and the foremost is lifestyle management. You need
Right.
to keep a check on your weight. You should be in a BMI range, which is actually for your height and weight. Weight loss is very important as this will remove all the extra hormones in your body. Even
Okay.
10 to 15% of weight loss will definitely help you out.
Okay.
After that, having a balanced diet, having a lot of vegetables, fruit included in your diet will definitely help you. Apart from that, exercise, doing exercise is very important. Even for normal lifestyle, getting aerobic and weight training exercises in your daily routine will really help you out.
Okay.
Apart from these, when you're trying to conceive, then definitely a need with a talk with a gynecologist or a fertility expert is very much necessary. And you can go step by step. Firstly, you can try naturally with medicines, what we call as ovulation induction. If that doesn't help in 3 to 6 months, you can go for IUI for 3 to 6 months. If that also doesn't help, then you can definitely think for IVF.
Okay. So I think maintaining a healthy lifestyle and then
Mm.
adhering to the treatment plan as prescribed by your fertility expert is
Yeah,
actually mandatory for women who are
exactly.
actually fighting PCOS. Right, ma'am.
Yes.
So on that wonderful note, we really appreciate your presence with us today, ma'am, and I'm hoping that the enlightening information shared will be valuable to many women out there. So thank you so much for joining us. It's really
Thank you
been a
so much.
pleasure.